St. Vincent's closed, is now closing, right? And you put up a little screen map saying, oh, well, we have there are all these other facilities for care, but they're actually urgent care facilities, aren't they? Can you please tell us where the closest two EDs are after yours closes?
Well, okay, so you have where St. Vincent's was, you have the Healthplex is a freestanding emergency room.
Right.
If you
And so if you need anything further, then you have to go by ambulance somewhere else. Okay.
What I was going to say is, so you have that. You have Bellevue and NYU are a little bit to the north, and further to the south, you have New York Presbyterian downtown,
which isn't ED.
Yeah, they have an ED there. Yes.
And what is that location? I'm sorry.
That's basically down by City Hall. By City Hall, but in the entrance to the Brooklyn Bridge.
All right. So it sounds like you're saying there's a pretty big circumference where there's no ED now. And anyway, for many blocks. Okay, but thank you for that. You also showed a slide earlier where you said that you have invested a lot of money, and you showed a lot of the services that are now offered at Union Square and lots of other places. And you were talking about the investments there. So it looks like those are services that are actually very remunerative, right? They're very sort of that a lot of private insurance is going to be paying a lot of money for. It's cardiac stuff, thyroid, sort of high-end services. I wondered, can you tell us how much money has been how much investment has been put into your campus by Mount Sinai in the last few years compared to those other state-of-the-art expensive facilities?
Well, I will tell you that they've covered over $100 million in losses every year for the past 10 years. They've invested, and by the way, there are programs and services that take Medicaid and Medicare in those facilities that we talked about. The Urgent Care Center at Union Square takes Medicaid. There are a lot of the facilities for the seniors that clearly take Medicare. So there's a lot of public insurance that is taken care of there and accepted in those programs.
But active investment in the Mount Sinai.
Well, they would argue, and I would tend to agree with them, that they have put in over $1 billion of the last 10 years covering the losses of Mount Sinai Beth Israel. That's actual cash in an it's not an investment in infrastructure, forgetting about repairs and other things that they've done. But the point is that, that is money that was spent by them.
Okay. But you're saying that as far as you know, there hasn't been sort of new infrastructure put in there.
Well, we put in that building, there was refurbishing, there was work done, there were things that were done. But remember, over the past 4 to 6 years, we had been looking to build a new facility over by 13th Street. So you weren't looking to make huge investments in a facility when you were looking to build something new. And they did make a major investment and built the facility down on Rivington Street, the Behavioral Health Center.
So, all right, got it. So nothing new there. Okay, so as you said, that's
excuse me, that's brand new. That just opened.
Not at 16th Street. Right.
But that was always moving there. Even before we had this planned closure, that facility was always moving down to Rivington.
Right. No, we were just talking about whether or not there was new infrastructure or any attempt really made to encourage people to go there to 16th Street. But thank you.
Virtually, we have Lisa David.
Joe, I had a question.
Oh, sorry. Yes, JD.
Thank you, Brad. I think Katie has expressed my concern, which I can't express too well, but the people living in the immediate vicinity, are they going to have a long way to go now? Is that being taken into consideration? That's one question. Katie's concern is also my concern. Secondly, this might be a dumb question. How can you operate with $100 million loss every year? Who's giving you the money? And where is that What's going to happen now?
Well, okay, I'm going to answer the second question first. It's not a dumb question. That's the point. Even if we built the new facility that they were originally looking to do when it was within a reasonable cost, it was probably still going to lose money overall because some hospitals just lose some money. I mean, but a $10 or $12 million loss is sustainable. It's not my money, but but 100, that's the whole point. A continual $100 million loss is just not sustainable in today's world. It just couldn't keep going that way. That's why this decision was made. Your first question as to where are patients going, I'm assuming you're asking about the emergency. Are you asking about the emergency people?
Yes, emergency.
Okay. I know that that's being looked at, and I clearly understand. I understand your concerns. I don't have a perfect answer for you at this point, but I do understand that that's one of the reasons they're talking to the other hospitals and working on that because of that. I mean, that's an immediate issue that I understand your concern.
We'll go to Lisa David first, virtually, followed by Betty.
You're still on mute, Lisa.
Thank you very much for reminding me. I like previous person who spoke, I have two kids who lived out of the St. Vincent's emergency room when they were little. And the loss of that was extraordinary to me. That my primary care was actually, the pediatrician was actually a Mount Sinai pediatrician, but since it was located close to me and we didn't ever have to be hospitalized, that was very convenient. But the disruption of the loss of an emergency department is huge. We have gone to, and it's fine, the freestanding emergency room there, which is affiliated with Lenox Hill.
Yep.
Northwell.
Yep.
If you need anything, they take you to Northwell. They take you to Lenox Hill. For you to not go to Lenox Hill requires a huge amount of work of you getting people to say that they're going to accept you. So even if there's something close by, if it's not within your system, especially for emergency services, you're going to be thrown into a different system with different providers from what you are used to. So the disruption around the emergency services, I think, is big. I'm reiterating, I know you understand that, but it's more than just the convenience of getting there. It's that you are suddenly out of your little network of providers. Secondly, I just wanted to ask you about the other thing that really matters is the primary care. It looks like you've got all your specialists set up in very nice facilities downtown that will be still convenient. And I know that you said that the mental health support area has primary care, which Mazel tov, it seems like an odd place for you to be attracting people looking just for general primary care into. But the primary care physicians that are part of the hospital now, where are their offices?
Okay, so I'm going to answer both of those questions. And again, I clearly understand the concern, and I think the elected officials' concern who have been talking about it is clearly on the emergency services. I think that everything I'm hearing and seeing, so I understand that. Okay, primary care at the behavioral health center is a step forward that, yes, anybody who lives down around Rivington can access that and use that if they want, but it's for the original design is, the fact that you come in for some behavioral health services doesn't mean you don't have a cold, doesn't mean you don't need a checkup, doesn't mean, so that's sort of why that's there. No, we don't really there's no primary care at 16th Street. So wherever your doctor is, your doctor's still going to be, whether it's in a Mount Sinai physician's office or it's at an urgent care, wherever you go, none of that is changing. We don't really deliver primary care at 16th Street. It's an inpatient facility. So that's not going to change. So wherever you're going for your doctor.
I understand that, but I mean, that's probably true for every hospital, but they don't live without primary care.
No, but what I'm saying is so the only
Also,
answer.
where are they going to be admitting?
Oh,
I guess, let me tell you
okay,
something.
no, okay, okay.
I work in social services. If
Okay.
I close a program, New York State requires that I
Lisa?
provide places that people go within their
Lisa,
community to get
okay,
to the services.
I apologize for misunderstanding your question. You will be given the option. Obviously, if you are a Mount Sinai patient, and again, for some of Community Board 4, you have a full service Mount Sinai hospital sitting on 59th Street. So you will be given an option of, if you want to stay in the Mount Sinai system and you need surgery or whatever, you're going to be given an option of going to any of the Mount Sinai hospitals in our system. One thing I also should bring up, and when I fly through the presentation, I apologize. The other thing that's interesting is over 40% of our patients still inpatient at Beth Israel down there, Mount Sinai Beth Israel on 16th Street, still come from Brooklyn also. So they clearly have options to go as well. So you'll be given a choice. Obviously, Lisa, we would want you to stay and use your doctor and go. And yes, you might be somewhat inconvenienced for those inpatient days. I'm not going to tell you you're not. But thankfully, most people aren't in the hospital very long,
Lisa, other questions?
I just wanted to say, are the patients aware of what the implications of this, do they know? And what notification requirements do you and your faculty have, your physician base have, to let patients know what is happening and what their options are?
Okay, so there is a prescribed manner, and I'm not the perfect expert on this. There are rules and regulations that the State Department of Health requires. Patients are getting letters. This is clearly not being done in. You're muted again, Lisa. It's not being done in quiet. It's been in the press. We've sent letters to our patients, and at each step as you get closer to a closure, you're informing the patients, you're giving them what their options are, you're telling them what they do, who they can contact. We have lines specifically for people who have questions about the closure so they can find out what's going on for them specifically.
Very much. Let's go to Betty.
Thank you, Brad. I just had two things which are not quite on the same theme. My husband had to go somewhere on 911 ambulance and ended up in Beth Israel. And I think that the care was okay, but boy, is it creepy. He was on a floor that is half empty, and walking from the elevator to his room was like it was a ghost town. So in general it had sort of a weird vibe. I'm just saying, I realized that the building is shutting down, and it was very clear that the building is shutting down. So anyway, I think the care was okay. And the other thing, this may not at all be your topic, but every day when I walk past the ghost town, I wonder what is going to happen to this building. It struck me because I'm interested in affordable housing and community facilities. I thought, oh, look at all this space. Is the building going to be torn down, or could it be repurposed to?
Okay. I'm sorry to interrupt you. I clearly, putting what's going to happen with the patient care and the healthcare and all that, obviously the next most important thing, and this obviously becomes a big issue for Community Board 6, is what's going to happen to the property. Obviously, it's too soon to tell. It's not being sold at this moment. No property's being sold. On the main campus area there. I'm sure, yes, it will be put up for sale, and that is going to become a whole issue of whoever, purchases it at that point. But I can't tell you, I can't answer.
In itself, separate from the healthcare issue, right?
Yeah, it's separate from the healthcare issue, and that's down the road a bit.
But it would be sold like a private development?
Yeah, here's the thing. like anybody else who is selling property, Mount Sinai is going to look to maximize the profit. That doesn't mean that a university might not buy it. It doesn't mean that somebody else. I can't tell you that because, look, you have NYU down there that tends to buy a lot of property that becomes available.
But again, let's not get too far afield.
Right. I can't. Everything we say about that now, Joe, is speculation.
Right.
Okay, sorry, I know it was a little off topic,
Yeah.
but I just.
Let's go to Dolores next.
Brad, I was born at Mount Sinai, but I'm quite disappointed in how you're presenting these changes that are happening. And I wanted to just be on record to say that what would be helpful is you've acknowledged what are the main concerns by the electeds, by the community, et cetera, and you have not really focused on that. Acknowledging those concerns and then stating very, very clearly how Mount Sinai is working with its other campuses, with the other members of the hospital community to mitigate. That would have been really helpful. And I think going forward, as you continue to wind this down, the communication would be better received if people are hearing that acknowledgement and a clear-cut, decisive response to how you're trying to get there, knowing that all of these things aren't necessarily going to go smoothly. But I just wanted to say that I'm disappointed in how this was presented.
Well, I apologize for presenting it quickly, but partially that was trying not to keep you guys forever. Look, this isn't an easy topic. It's not something that I'm happy to be here. Besides working there 25 years, my mother was a patient in Beth, Israel in 1981. So I have going to soon be a 43-year history with this institution. So I understand what you're saying. Part of the reason is that as quickly as July 12th may be coming, we filed a plan not that long ago, and we're working on the details of seeing how it's worked out. We don't have all the answers to those questions yet. And as we do, we have committed to update everybody and keep them abreast of what's going on. So as the plan becomes more concrete, as we get feedback from whether it's from the state or whatever, or from the other hospitals, and we have to figure out what we're doing, we'll clearly let you know. It's not that I'm trying to skip or not tell you anything. I can't tell you what we don't know yet. Other than we filed a plan, this is what we would like to do. The state still has to approve it. It still has to go through measures, and they may come back with counters to say, well, we'd like you to stay open till December. I'm just throwing that out. I'm not. So that's why I can't answer things at this moment that I don't know an answer to, because we haven't gotten complete feedback. I can only tell you that from the public meetings I have, the biggest concern does seem to be about emergency care.
That response there has been more helpful than the rest of the presentation. So thank you for that, Brad.
Okay.
Thank you, Brad. Maria has one final question. Yeah.
Maria, you can ask as many as you want.
Oh. Sorry. Yes, thank you, Brad. I heard your answer. One was, given what Dolores mentioned, I thought that was a good question, and it made me curious because you do keep mentioning the ER closure. What is the second biggest concern that a lot of constituents or neighborhood folks have?
Oh, it's a
Can you
good
hear me
question.
okay?
That's actually a good question. Weirdly, I do think some of the concern is about what's going to happen to the property after it goes. I think where like Lisa asked, where they're going to access their services. But the most prevalent concern right now that I've seen at the community board meetings and meetings I've attended is the emergency care. I mean, from an employee standpoint, I think we're doing solidly by our employees. We're covering them. We're making sure they have jobs, certain things like that. I do think there is, but healthcare is a weird world because, people don't always think about, oh my God, I have to go to the hospital. Where am I going to go? It's not at the top of their mind right now. And thankfully, hopefully they don't have to go to the hospital too often. But I think that that's probably the next, and it goes along with along the lines of like what Lisa was talking about. Where will you go once you've seen your doctor? And if you do need to be hospitalized, what will happen?
Yeah, definitely. And when the property does go, it's Mount Sinai's property that's.
Right.
Yeah, I know. Just curious. My other question was at Rivington. So I remember we had a meeting like 2 years ago, Brad. Joe and I and Dr. I think Singh, head of psychiatry.
Probably, yeah, Pramit Singh, yes.
And we had talked about, yeah, we were talking about inpatient beds at the time.
Mm-hmm.
And I know that some were going downtown. So I'm curious at Rivington, how many beds are there? I just want to see if it's what you was said was going to be there at that time.
It's about 100 beds. I can't remember. It's somewhere in and around 100 beds of a mix of behavioral health and, substance abuse.
Okay. All right. That was it. Thank you.
Which I'm pretty sure is about what they said back then.
Let's go to Christine Berthet. Did you bring her over? Jesse?
I think I am.
Christine, are you there?
Yes. Can you hear me?
Okay, go ahead. Sorry.
Yes.
Yes.
So thank you for this presentation. I'm going to take a very larger view, which you may not be responsible for, but in a time where we have so many mental patients and we are all we are hearing constantly from the administration that there are no beds and we don't have a place to put them. I don't understand why we are closing a hospital. It doesn't make any sense to me. And I mean, it may be the city and the Department of Health, but have you had any discussion with the Department of Health to figure whether your capabilities and your hospital could be converted to take care of that issue and be paid? Obviously, you need to be paid by the city or the state to take care of that issue, because it's just those two things don't add up for me.
Well, as far as the behavioral health, we built a brand new facility with a number of beds, which aren't full at this moment. That's a separate issue, and that's not even, that's the first time somebody's even raised that issue, because, you don't have a lot of instances these days where people are building full, structures that size for behavioral health. But that would be, if somebody else, first,
So I understand, Brad. I mean, I know this.
It's also, by the way, behavioral health is a money loser.
We know. I understand.
No. So what I'm saying is, so you're not going to have any. Now, if the state wanted to build a facility or the city wanted to build a facility where it's coming in, but no private hospital is probably going to build a huge facility that is going to lose money from the outset.
So what I would like to ask the chairs and the committee is to include a letter to the state and the city and asking how come they are not taking this opportunity to fund, and especially because there is a building and there are people, to fund a new facility to take care of the health, and we know it's losing money. I mean, we know it needs to be funded, but this is the problem of the homeless. So
Christine, also keep in mind that it would probably be at least $1 billion to build. No. What I'm saying is it would probably be at least $1 billion to rehab the facility to what would be, what you'd need to do it. And I'm sure it's more.
Brad, let me just cut to the chase.
Sure.
Our board has been very involved in this issue of mental health and providing adequate beds and providing adequate facilities, because they're just not being provided. And the state has actually moved in the direction we've been pushing for about 2.5 years. So I think in any letter we write about this closure, we'll be talking about to reserve part of the Mount Sinai campus and work with Mount Sinai and fund Mount Sinai to provide this type of service because you have a location and a structure that could be repurposed. That's a great idea, Christine. I think it's something
Thank
that
you.
we've at like a dog with a bone for 2.5 years. So good to make this connection.
And Joe,
Thank you.
quick point of clarification. And don't these EDs have a psychiatric function to it usually? So
Not
I
all
don't
EDs
think
do
it's
have it.
necessarily
Not,
about
no, not all of them. No.
not all of them, but the ones being closed, do they currently have a psych function?
We do, but we will be able to figure, we're opening up a new, we will figure out a way to replicate.
Right. So all these concerns about new facilities for mental health care, I think this is an existing kind
This
of
is not
function.
really, it's not really the same thing.
It's
This
not the
is-
same thing, but you can bridge it.
Doing intake at a emergency room versus providing a bed with long-term care is a
It's not the same.
separate program entirely. So we really need that. We need those long-term beds and they have a location that maybe they could land, or at least part of it.
There are existing psychiatric treatment wards or functions within the EDs being closed. I think that should also be addressed.
They're not there.
They're not there, but he just said some of them do.
No, what I'm
That's for
saying is, but we have a full service mental health facility. So you're talking two different issues
Okay.
here.
All right. Thank you for clarifying.
I think we've had Mike Noble. Mike Noble, you're our last speaker from the committee, and then we're going to sum up, have some discussion. Mike,
You're on mute.
Mike is nowhere.
Well, it took a minute to get on.
There you go.
Thank you, folks. Brad, let me just start quickly tell you that my son was born at Beth Israel 35 years ago. I was there 5 years ago with the dual problem of cellulitis and Legionnaire's disease. And I can tell you that you folks saved both of our lives. All right. It was a great experience. Love that hospital. So I hate seeing it disappear.
So do I, Mike. So do I.
Yeah, well, it is going to predecease me, I think, in any event. Let me ask you this. I've changed health insurance a couple of times here recently, and I've always had Mount Sinai doctors, all along the way, and all of a sudden they're dropping me one after the other. And I want, because of my insurance.
Mike, Mike, don't do other information other than who's your carrier?
Well, now it's Blue Cross Blue Shield.
Oh,
all right.
That's interesting.
Yeah, I know. Well, they have multiple plans, but I wonder if you folks are dropping those plans because they might be tied to Medicare or Medicaid or whatever.
No. This is out in the public. You may be reading. We are in a negotiated fight right now with United Healthcare, who is one of the worst payers in the world. And, we learned once the transparency laws come in that they're paying us about 50% less than they're paying some other institutions. So we are in a contract dispute with them. There's two different things. The hospital itself takes any insurance, any and all insurance. Individual doctors who aren't Mount Sinai employees, or if they're private, they may be affiliated with us. They have the right to take their whatever insurance they want to. We don't control that. And sometimes that changes because the insurance companies pay them very poorly.
Indeed, they do. So no, that clarifies it for me a bit. Even though I visit the doctor at a Mount Sinai doctor's building, right? There are many of them. They're all over the place. Each and every one has their own separate choices as to, right?
Yeah, it depends if it's an well, that's also the difference. Then not all of our facilities are what are Article 28, which are hospital-based, even though they would accept anything. The ones that are in, even though it says Mount Sinai doctors, there's a lot of those are private offices.
Okay. I've got you.
And the individual there's a problem in this world, which all of you know, and this happened right before I joined healthcare. Hospitals are not for profit. The insurance companies are for profit. There's a problem with that, That's a
Yeah.
problem.
We're not going to solve our problem with our horrible.
No, I
health
understand
system
that, Cheryl, but
tonight.
I'm just saying it's
We
inherently
can talk
a
about it, but
problem.
it's not going to get solved. I'd like to bring now this discussion to conclusion. And I think two things have emerged. So let's see if we have some consensus on it. One is we want to know what's happening with the emergency services and how they're going to be cited, both coordinated and or retained in some fashion at that location. That's one thing I think we have an agreement with. Yes, heads. Yeah, I got to speak into it otherwise.
I think it would be, I don't know if it's on. I think it would be great, like, if this whole facility on 16th Street is going to close down and they're like, oh yeah, there are other places. Are other emergency rooms going to be staffed more?
To accommodate
Right.
the over, right.
Exactly. So that, because I think one of the big concerns is already we know that there are long waits at emergency rooms, and now if there are going to be fewer emergency rooms, will there at least be more staff on hand, right? So we want to know about what the staffing levels are of the remaining emergency rooms.
Both Mount Sinai and non-Mount Sinai.
Exactly. Yeah.
So that's
By the way, I can only answer, I can look into the Mount Sinai ones for you. I can't answer for the other institutions.
we're going to give you the broad question and have to answer everything eventually, Brad, because
Yeah.
so you have to answer everything with the state. So the second,
That's fine.
The second issue is what Christine raised was the idea of when the Mount Sinai campus is repurposed at some point in the future, that part of that is used for a mental health facility with inpatient beds and residential beds, which is sorely lacking. And the state has now decided that's a new priority, as we know, because of the issues we've had year after year in the past number of years. So those are the two components to this broadly. Do you have a third?
Yeah, I guess I would also say, it just seems to me that this is, that we should include something about asking the city and the state to be much more vigilant when hospitals want to merge or do deals in the future, because clearly it doesn't end up benefiting residents.
To deal with the long-term consequences
Yeah.
of mergers.
Just to sort of point out, like, hey, here's this thing that happened that was supposed to be great, and it turns out not so much for the local residents, right? And so we would just, I think we should put that in writing.
Got it. The JD?
The second thing you raised, Joe, about Christine's suggestion, I have a little question about that. I mean, it would seem to me that if it's going to be repurposed, the first concern should be repurposed to serve that immediate community, not the larger mental health community.
No, the
So-
specific issue is on the mental, she raised the mental health issue.
I understand, yeah.
And we have a sore lack of, as we know, mental health beds for long-term care. It's not about going to the emergency room, getting a referral. You're out in 10 days. There's nowhere for you to go. Similar to what we did with Bayview, where we came up with a proposal.
Joe, I think
long-term.
I understand that, but my question is, that's fine to explore, but before that, if it's going to be repurposed as some kind of clinic or hospital or whatever, shouldn't our first concern to be that immediate surrounding community that is losing all this?
I think
No?
we have to recognize that these services are being lost, the hospital services, period.
Yeah.
And that is never going to be repurposed for the current use. Christine raised an issue of a new use for long-term residential treatment facility, because those beds are sorely lacking in all of Manhattan.
I understand that's all of Manhattan. I'm talking about this immediate community. It seems to me that should be a concern first ahead of serving the larger Manhattan community.
But we should say with a priority to the immediate community. Yes. So with those general ideas, that's what we are.
Joe?
All those in favor?
Joe?
Whoops. Oh, so question.
No, yeah.
No?
First off, a couple of comments here. Who are you expecting that we would be addressing? Who would we be sending some type of letter to?
Well, I think we write the letter to Mount Sinai and then we send it to the state regulatory agencies that control the process.
Okay, if that is the case,
Right.
then I think that it is not appropriate for us to be writing to Mount Sinai about having to understand how to coordinate all the care. If we are addressing specifically the agencies, then that would be appropriate to say, that we would like to see, based on the presentation from Mount Sinai, how the state, how the city is coordinating the loss of these services. But writing this to Mount Sinai doesn't make any sense to me because there's a lot that's not in their control. That's one. And second, piggybacking on JD's point, I think that it is important to recognize that this physical structure can be repurposed. I do not think that it makes sense for us to be prescriptive and say that it should be for a new service of mental health, particularly because the main concern we're hearing from residents is what they're losing there. And so that if there's an opportunity to understand what other uses and list them, potentially new hospital service, new or just standalone emergency, or mental health, that is much more comfortable than being prescriptive and saying, please think about in this space, which is now a vacuum for emergency services, to just think about doing mental health. That's
I'm sorry, actually misstated then. I noted in the first point that to use the campus or other locations for an emergency room first. That was our first point. So we're not going to let them off the hook to say they just exit the emergency business at all. Like there might be, this is a large campus. Part of it maybe can be retained for emergency room use.
Right. I'm pointing out, very similar to JD's point, that there's an immediate expressed vacuum for this community. And to be so prescriptive to say this would be a great idea for solving the greater problem does not make sense. I think that it's more helpful to say we envision that there's an opportunity here for X, Y, and Z, and hope that the state, the city, etc., the federal government even, can come up with plans to address all of these medical needs, and particularly the needs of this community. So that's where I'm a little bit concerned about jumping on an idea and being prescriptive about it before we're even at a point of having all the players involved.
I want to know,
where the
we're
money's
not going to
come
be
from.
prescriptive. We're going to talk about emergency care, which is the first thing we all agreed upon. And I think this is a larger enough campus that we can use the phrase a portion of, to make it clear that it is not A or B, but it's many things that can go into the same location.
Okay,
but I also
acceptable.
want to note, I still think we should write to Mount Sinai and copy all the regulatory agencies, because Mount Sinai is come here to present to us, and it's up to them to work with the those agencies to figure out a plan, not just the agencies alone. I don't want to pass the buck to the state agencies and take Mount Sinai off the hook.
Can I make one small thing, just a thought? It's just a thought.
Give it a go, Brad. We might shoot it down.
No. If I were on your side of the podium, I might write this to the State Department of Health and CC us. I would potentially do it the other way around, because in the end, it is the State Department of Health that has to, much to what Dolores is saying, they're the ones who have to examine the plan and look at the plan. By CCing us, you're not taking us off the hook, but you're directing it to the people that you want to direct it to.
Yeah, but I think you're here talking. Katie's next, then JD.
I was just going to suggest that we do 2 letters. One, that we write to Mount Sinai about what the issues are that they can address. And the other one is that we write specifically to the overseeing authority and on the bigger issues about what's going to happen, that we think that the state should be stepping in and thinking about other things there. That's not Mount Sinai's responsibility.
We don't need to write 2 letters because this committee writes many letters, and we can do one. And I'm going to say again, Mount Sinai is presenting. We should be responding to Mount Sinai and asking them to coordinate with the state. When we send these copies of letters, they get read by the agencies. Trust me, the agencies write back to us all the time. Absolutely, they do all the time. Yes. Yeah.
Oh, sorry. Yeah, that's right. Oh man. How long have I been doing this? Jesus. No, I like the idea of the city and the state and writing it to, in my mind, it would be to DOH. But what? I think that's a good idea.
I think the government relations representative definitely doesn't want a letter written to them. They want a letter written to the state. And my answer is they're the ones on the hook. They have to coordinate. They know they've made some mistakes here, how they're doing the ramp down, and everyone's going to be involved in this. Yes. Yeah. And we asked for a response from everybody on it. We can put in a letter, and we'd like our state agencies to respond and assist directly. Make it cleaner, not run it around. Thoughts, anybody on this?
Can I just add one thought, Lisa David?
Yes, Lisa, sorry.
The timing of all this, the reality is the Department of Health has to approve the closure plan.
Yes.
So, and I think if I'm not sure if it matters who we address it to, if it also includes the statement of, we'd like to hear a response from the state. But they're the ones that will push for this. Mount Sinai is not going to volunteer to step up and do it. I'm going to say that. I'm going to say that. Secondly, I just wanted to mention that if there is, either as part of this or not, a separate letter, a consideration of using a portion of the facility for behavioral health, long-term care, I don't even think Department of Health can make that happen. That's a governor's office issue.
The governor's going to be on this letter because she's the one who's been proposing all this mental health.
Okay, that's all. It's just like the Department of Health will not make that happen.
Right. Katie? Yeah. Oh, we're good. So on this letter that we've talked about for a good time, and we're now at 7:46. Is there a motion on this letter as described? Anybody?
So moved.
That it's very important to reach out to the electeds about this because it could be a push, as Christine says, and Dolores says, as Katie has said. I think we need to push the electeds as well as Mount Sinai on this.
They're going to be copied, but we should have a meeting with them to discuss it as a follow-up.
Yeah, good, thanks.
Moved by JD. Is there a second? Second by Paul. All those in favor, please say aye. All those virtually who are excused, one says yes. So it's passed. Sorry? Right, but they can't vote. They're not here.
I'm excused.
Oh, Dolores is excused, right? I'm by the way, I apologize to everyone virtually. It's so hard to figure out who is excused or not because this is our ongoing problem. So maybe we're going to give you like a purple hand or something so we know who it is going forward. So all
Or
those
maybe at
who
the
are,
beginning of the meeting, we identify if we're excused or not.
right. So all those who are excused and in favor of this letter, please raise your hand physically.
I think I was
Great.
excused.
See, that's the problem. So Jesse, please help us again as every meeting.
Lisa, I'm sorry, just so I understand did you complete the form and
Yes.
Okay.
So Lisa and
Dolores and
Dolores
Betty.
and Betty. Thank you. All right. And we're going to have to figure out the system better because every time we have this discussion. Thank you all very much. This concludes the first part of our meeting. Now,
I'm going to leave, guys. Good night. Have a happy and healthy new year.
Brad, thank you so much. Really.
You're welcome. Take care, guys.
So the second part of our meeting, we were supposed to have tonight a presentation from NYCHA and Related in Essence regarding interim repairs. And we put something in the Dropbox in the presentation and they canceled today. Jesse, do we know why? No one can hear you.
Sure. So Essence contacted us and let us know that they were unable to attend because of COVID, and that Related was not in the country.
The entire company Related?
And representatives, the appropriate representatives, and then NYCHA asked that they would, because they're so integral to the part of the repair plan, that they would not feel appropriate to attend and present today.
Okay, so I was ill in December, So
I would just like to make that as a point.
yes, yes. So so therefore, we're not getting that presentation tonight, but we will take anyone from Elliot, Fulton or Elliot, Chelsea, who is interested in speaking to this, and we'll give you 2 minutes each. Yes?
Yeah, and just to be clear, the presentation is on our website, so you can get it. It's on the public Dropbox.
And we're going to have a full discussion about it at our February meeting, obviously.
Yeah, I mean, my thought was this, I had a conversation with Maria earlier today that we would have folks speak if they'd like to, and obviously you all could, if you chose to, put your questions in a written form to them so that they're prepared for whatever is raised here tonight, so we don't lose the folks that speak.
So I'm going to ask you to so please come up, please.
Hi.
Is this Jackie Lara by any chance?
Yes. Can I go over there? Because I'm.
That one doesn't work.
No, but I'll take.
Yes.
I'm behind you guys.
Yes.
What? Oh, hi.
No.
Okay. I'm getting dizzy. You guys are giving me go.
Okay, Jackie Lara is speaking next. Go ahead.
Hi. Many blessings to everybody. Hey, listen, guys. I'm really sick. I have lung disease. I have heart disease. I suffer from depression, which leads me to an eating disorder. I could go with a week without eating. And I come here because I sincerely am fighting for my home. I don't know what happened. This world is going crazy. I mean, we have war. We have all these migrants coming in. What happened to love is love? What happened to caring? What happened to compassion? What happened to human kindness? I mean, I feel all that. I wish I was the TA president to Fulton Houses, because believe me, I will make a big difference in that development. Our TA doesn't care, but I do. That's how much compassion I have for my residents. They all love me there. And that's how much love I have for Fulton Houses. So, guys, please, let's consider this. And anyway, anybody that could demolish a freaking senior building, they're a heartless bastard, So, let's get rid of Related and Essence and the whole NYCHA. Let's get rid of Miguel Acevedo too. Thank you.
Next, Maria.
Next is Santa Telira. Did I say your name correctly? Santa Tejada. You okay, Jackie? All right. You're speaking?
I'm speaking on her behalf because she speaks she doesn't speak English. Okay. So Santa, she does not speak English. I'm gonna translate for her. My name is Santa Tejada. I ask for your help in preserving our homes. I've been a tenant at the Fulton Houses for the past 35 years. I've always been an exemplary tenant and paid my rent on time. It is detrimental to both my special needs grandchild and myself to be asked to be moved from our home. All we need are repairs, not for our homes to be demolished, nor our rights to be revoked. I am raising my grandson on my own and have concerns of feeling in isolation with the new buildings. The population will increase tremendously, and I will feel lost among so many strangers. Each building with its own terrace will cause division, and sitting in my terrace will lessen my interaction with the rest of the community. I like interacting with my neighbors and passerbys while sitting in the park bench, as I am accustomed to. Now, I have a home. I love my home. I'd hate to see it disappear. We don't need new buildings. Oh, so Santa Tejada, she's a tenant from the Fulton development. 419. Gracias. Thank you. Okay, and I'm also gonna translate for Luis. Oh, here we go. Okay. My name is Luis Sanabria from Fulton. I oppose demolition because I love my home. I've been living here for 52 years. My neighbors are a source of company, and I have become like family I am also the handyman of this community. And over the years, I have assisted many of the tenants in the Fulton development. I never have seen any apartments in poor condition, as Essence and NYCHA are communicating to the public. Our buildings are surely not deteriorating. Yes, they are in need of repairs, upgrades, and maintenance, but the narrative of deteriorating buildings is an outright lie, a fabricated story to follow through on their plans to take over and invade all of Chelsea. If other buildings in New York City have survived 100 years, 200 years, strong and sturdy and on their foot, then our concrete brick, plaster walls, fireproof buildings could survive and surpass 200 years. Look at the Terminal Warehouse at 261 11th Avenue, 132-year-old, and was recently renovated. The designer's Cook Fox architect had the capabilities of adding their own element to an already existing and well-constructed building to create a work of art. We've been on the Essence tours, and anyone who has an eye for what really is something of good quality know that these buildings that Related want to offer us project folks is just makeup. The kitchen cabinets flimsy, the hallway gloomy, the apartments look like a dormitory room. The buildings as a whole felt like staying at a hotel in Atlantic City. If I'm going to walk with a Gucci bag, it has to be the real thing. Fake bling don't impress me. Please, we need and insist to see the evidence that was submitted to HUD, pictures, apartments, units, and a walkthrough. We want to see the breakdown that our NYCHA buildings cost $1.5 billion to repairs, the features of our building. They claim they are repaired. Thank you.
And what was the
Thank
what
you.
was the address? The address
Alexa. I'm sorry?
from the last person, the address?
Oh, 419 as well. Now we have Alexa next from 415 West 25th.
Good evening, everyone. Good evening, everyone. Thank you for the invitation and listening to me. I live on 415 West 25th Street since 1969, and I love my building, and I feel comfortable there, and I don't want demolition. And I don't want them to change Section 9. But I hear when I've been coming to these meetings here, they have money for the state and city. The state used to fund for Chelsea buildings, and then it stopped, and then it converted into federal. And now the federal doesn't want to pay us, but now you see so much billions of dollars that are being distributed for the high lines out there, the piers, and we're not getting any help at all. We're not getting anything we're the low incomes, and we're the people that paid our taxes and that lived here, and they're honest people in NYCHA. They're not a lot of crazy people there, have good neighbors. I think we should be taken for consideration in the federal HUD to fund us and make the repairs for our apartments where we don't live. We don't live in poverty. I mean, if they do have to make a repair in the building, let them make it, but that's it. I don't want to live in a sheetrock building that maybe in a couple of, maybe 20 years, the building might sink, since I've heard that the landscape is sinking 1/4 of an inch every year, and we have floods here. Floods. We have recently had floods. Oh, I'm sorry.
Thank you, Alexa. Next, we have Salinas. And
Oh, I live in 288 10th Avenue. They say that NYCHA will still be involved. That's a lie. If Essence starts to manage the campus, as soon as that happens, NYCHA management leaves. HOU will move into the management office, as said by Jamar Adams. Third-party management company replace current on-site staff of NYCHA management. The maintenance crew will also be replaced. NYCHA will slowly step away as they have in other Rat Pack conversions. We will be fully privatized. I've heard testimonies of people who regret moving out of Section 8 vouchers. Their rent has gone up to 40%. Others have had to make the decision of paying full market rate rent or cut back on their hours to stick within the Section 8 income standards. This keeps people from progressing. On Section 9, if your income goes up, they just raise your rent to meet the 30% cap of your income. Section 8 cannot guarantee you what Section 9 can. Neither can Essence. They'll just stick to the protocols of the day. Richie Torres, a Bronx Congress member and Republican, wants to slash Section 8 funding. What will happen when a Republican goes into office? How secure are you really under Section 8? Essence will not have all of your backs. You're just as vulnerable, if not worse. Stay where you're most secure. Don't say you wasn't warned. Also, they always contradict themselves. Be vigilant. They say the buildings are unrepairable, but give a bogus cost and say buildings cost 1.5 billion for repairs. So make up your mind. Are the buildings repairable or not?
Salinas is going to speak for you, Caesar. So can you come on up and stand next to her so we know, everyone knows who you are and in the Zoom world as well. Thank you. See you at the next meeting. All right, thank you.
Okay, so should I say that? Okay, so I'm speaking on Caesar's behalf. Okay, yes, okay. He lives in 415 10th Avenue. I talk to neighbors, and I mean the ones that live between 10th and 12th Avenue. I see them walking their dogs through our campus. I ask them if they feel safe walking through here, and they look at me like I'm crazy. Like, of course I feel safe. I've spoken to the tourists, and they get surprised when I tell them these are projects. The only people this community aggravate are the real estate developers. This false concern about the tenants. They are not social workers. They are not couch doctors. They are real estate developers. They are in it for a closing deal. They have to suck up to the tenants right now. We are their pawn, part of the transaction deal, their bargaining chip. And Mona Lee from Essence, who said, we care about the disabled. That's actually condescending. You have to add disabled accessibility to the design. If not, your buildings will not get approved. It's part of the Fair Housing Act. Stop insulting people's intelligence. Just be direct and honest for once and stop it with the manipulation tactics. The only working group we hear about is the 2019 group. What working group is the one that initially requested demolition? Where is that group exactly? We can't find the 2019 online. It's archived and accessible. But this secret meeting that requested demolition, who exactly were involved? HOU tenants, TA board members, CB4 tenants? The evidence for that is also concealed. Where exactly is this safe deposit box which contains survey results, and the physical needs analysis. And they always contradict. Did I say that already? I did, right. Okay, thank you.
Thank you. Thank you. And one last, Renee. Last but not least. Thank you, Salinas, for speaking for so many people today.
Hello everyone. Thank you. I come from the Elliott Houses. Oh, 443. I really don't know what to say other than this is a whole mess. The three people, or should I say the three entities that are part of it, can't even show up. I understand somebody has COVID, but if it's from Essence, Mona actually came last time when Jamar couldn't make it. Related, as Joe has just said, they have a whole lot of people. So somebody could have made it. And NYCHA, well, they didn't want to be here by themselves. Basically, they're using their usual thing, which is basically ducking responsibility and accountability. They won't be accountable. As was just said, that when it is turned over to Related, and I'm not going to say Essence because we know who's really handling the deal and who will be names on the checks and who will be signing them. They will leave. They have left everything. If you look at the Eden Wall bundle, it's saying it's $930 million. $1 billion is not a lot more. To be quite honest, it's amazing that I'm actually able to say that. So what? It's going to cost $1 billion. They got $1 billion already using NYCHA developments, and we all know about the EB5 program. So this is what I'm saying. Someone needs to be responsible. We need to be accountable. The buildings do not have to be destroyed. They are using a survey to justify the destruction of our homes, our community, and ourselves. We know they're not going to do this in 16 years' time. The first buildings will be the buildings for us, the people who live in the development. But it will take at least 10 more years, and we don't know who or the income bands are going to live there. We don't know if they're going to make it for only some people, the richest of people. We will be overwhelmed. Those are the things that have to be dealt with and have to be answered. Thank you.
I want to thank all the NYCHA attendants who spoke tonight. I just want to say a couple things. First, there are many times people speak and they talk about Section 9. Just so you know, our community board out of the working group from 2019 has stated that we support a RAD PAC conversion and Section 8. So be aware that that is what we've taken the position on for a number of years. The second thing is, as part of that, a specific issue about a rent cap and in Section 8, and that was a condition that we put on this. So therefore, that is another protection that would exist in any sort of RAD PAC conversion. So you, in fact, would not be under the normal Section 8 rules. Very important for us as a community in general. I'm sorry that this process has not moved ahead faster to get information. We have the community board's in the same position as the tenants here, and we are trying to continually work with NYCHA and Related in Essence to get information and to make it public and to post it and to get it out to you. So we're not going to stop with that as we proceed ahead. And we're going to see everybody in February again and continue the next thing to see what we can get out of this whole group that is not providing information. Thank you very much for coming tonight. I'll talk to folks afterward. A motion to adjourn.
Motion to adjourn.
Oh, no, really, there really isn't a discussion tonight because there's nothing that we're not going to take an action tonight because there's not. Go ahead.
There we go.
Joe?
Joe, I haven't been here quite a couple of months. But I did not participate in the votes regarding Section 8, Section 9 to Section 8 housing. But I do have to express my concern about that Because there is a big difference going from section 9 to section 8.
Raul, actually, to speak to this, you'd have to, I would say, get brought up to date on all the items in the Chelsea Working Group report where this was discussed and taken apart in pieces to making sure there were protections that followed through that did not get diminished by section 8. So you have to look at that carefully. And
Fair
then,
enough.
yeah, the board
I'll take a look
was
at
not comfortable with the section 8 conversion.
Okay.
All right.
Sounds good.
So
Motion to adjourn?
No, I'm sorry.
No?
We have one person online that has a raised hand.
Thank you, Nellie. Sorry.
Sorry.
Marnie, are you there? Marnie,
She's moving over now, Joe.
thank you. I'm
You're
sorry we
welcome.
didn't see you because we can't see that screen.
Can you
Marnie,
guys?
Yes, go ahead, Marnie. Can you
Okay,
hear us?
good. Yes, I can. Yes.
Thank you.
I just wanted, I just wanted to say one thing. Yesterday at the full board, I handed out a sheet that is from a website called the United Front Against Displacement. And it shows the difference between section 9 and section 8. And the person beforehand that was asking about this, like there really is like a key difference. And the one thing with section 9 is the rents are set to 30% of the tenant's income. But that 30% is its long-term affordability. So under section 9, it's 100%, it's that 30%, 100% affordable for the entire, it can go on for like 30, 40, 50, 60 years, right? When it converts to section 8, the subsidy that allows tenants to pay the rent based on the income is tied to a temporary HAP, a HOP contract between the building owner and the government. And that contract can last between 1 and 20 years. And at expiration, private landlords generally choose not to renew the contracts and convert the Section 8 into market rate units. In addition, loopholes that can allow owners to turn Section 8 units into market rate units even sooner. So I think that's like a really, really important thing. And that's like a fact. So that's not like, it's not negotiable. That's something that actually really happens. But also the homeless and John Mudd's homeless and housing group, we just found out that Miguel Acevedo is hiring Arthur Schwartz to help Fulton House's tenant negotiate their leases. So that's really telling people that even Miguel, who was actually worked against his own people, he is now afraid for his own tenants. So he's hiring Arthur to help negotiate the leases. So I think that's a really important new piece of information that should make the community board sit up and take notice. So anyways, that's what I have to say.
Thank you very much, Marnie. And just be aware that Section 8 contracts can be up to 30 years, but as part of the conversion, there is a requirement for an ongoing subsidy at 30% built into a deed against the land. So there's a regulatory agreement. And I understand when you look at this from a sort of take it from the internet point of view, that's what you find, but there's more regulations that provide ongoing protections. Our community board and no one in the community would have supported this without those protections being in place. And I can certainly talk to you offline to give you that information. The second thing is, thank you very much for the information about Arthur Schwartz being hired, because I didn't know that the tenant association can hire an attorney to negotiate anything on behalf of anybody, and we'll certainly look into that. Mike
Right.
Noble.
I just want to say, Joe, I just want to say one more thing. Under the Baez case, Judge William Pauley held that when a building converts to Section 8, the Section 9 protections will not follow that tenant.
That is correct if you don't have the deal that was
also
negotiated as part of the Chelsea Working Group. I fully agree with you, but we added protections on top of that. So again, we should talk offline so I can get you information. Can I go to Mike Noble next?
Okay,
Mike,
Ruby.
Mike, please. Are you there, Mike? Nellie, do you see Mike?
Yes, I'm moving him over.
Oh, I see. Okay.
Okay, I'm back. Thank you. Let me just add on to what you said, Joe. People have to recognize this is different kind of Section 8 altogether. It's called project-based Section 8, where the voucher follows the property, the unit itself, not the individual, right? So it sticks with the property, right? That unit that you live in initially with your Section 8 voucher is tied to the unit, all right? It's not going anywhere. You yourself, in a year's time, can go off with a portable Section 8 voucher, but the original project-based Section 8 voucher remains there, right? So that's a protection for the building, for the development. That's how this thing gets funded. And beyond that, I mean, I was thankful that Joe mentioned the fact that we approved this PACT conversion, all right? And the reason for that is the funding aspect of it. And the funding comes from these project-based vouchers, all right? One thing that I think people have got to understand is that the demolition aspect of it never was contemplated by us in the working group, but it came up because of, you know, what it would cost to rehab this place. In order to demo public housing, you have to go through Section 18, which is part of the Housing Act of 1937 or whatever, right? So you do an application. The application is justified by the fact that you're now going to a different funding stream for your development. PACT, RAD, it's RAD actually, under the law. RAD itself is a justification for demolition, all right? It has nothing to do with the individual buildings being in disrepair and
Mike,
all
I
that.
think you're getting a little bit far afield from what.
But I want people have got to start to think about this. This is what's happening.
Mike, I think you're a little far afield. I just wanted to make sure people had some information. And,
all right.
I think we did pretty good for tonight. We're going to take it up again in February. Okay.
Yeah. Thank you, Joe. No, you're doing good.
Now may I make a motion?
Yes.
Motion to adjourn.
Second. Right, Pete. All those in favor, please say aye. Thank you all so much.